Good morning. Today I'll be talking about the Egypt healthcare sector. What are the opportunities and what are the challenges? What you can basically invest and build in healthcare sector, and what are the new trends which are working across the region. I've been working originally from Pakistan, but being working in the region for 18 years. And in Dubai almost 12 years, and we'll have office in Nile City Towers, and we are growing here. We have a lot of confidence, and that 2018 and onward the Egypt economy and all the real sectors, including the healthcare sector, will grow a lot. So to start off, where we stand, what is the current status? You have 94 million total population. With the new figures, it is around 100 million or so. Almost 10 million are living abroad, who do comes Egypt quite often. Average household size is around 3.9 house population. The very important thing which has a great impact on healthcare is that your average or median age is only 25 years. So you have a lot of young population which is there. Density, you have 91 population per kilometer, but the issue is that most of the population is in Nile Delta, and a lot of other area all over the Egypt is empty. Male-female ratio almost equal, 51% male and 49% female. Some of the key ratios. Egypt has 1.5 beds per 1,000 population. GCC region has 1.7, and MENA region as a whole has 1.8, so not very far behind. Doctors, 3.2 doctors per 1,000 population compared to 2.1 for MENA and 2.1 for GCC and 2.5 for MENA. And that's one thing which I'm going to touch later also, that the way the trend is moving, doctors could be a sort of an oversupply in Egypt in next 10 years or so. Nurses, 3.6 per 1,000 nurses in Egypt, GCC 5.1, and MENA region is 2.9. So these are the key figures where we basically stand today. How Egypt has changed in last 25 years. Some of the very good growth factors which you can see. Life expectancy has increased from 58 years to 71 years in last 25 years or so, or 35 years, which clearly shows a 22% increase, which clearly shows that there is better quality of healthcare is available, more people are living longer, they take care of themselves and all those things. So this is one of the biggest growth in the world, from 58 years in 35 years, 58 years life expectancy, it is now 71 years or 71.4 years. And MENA region is 73 years. Infant mortality rate, that is also a great improvement, 82% decrease in it. So it basically, by 1980, 114 babies, they die within 6 months when they're born. Now it is decreased to only 20. So that is another basically improvement. Under 5 years, so between 0 and 5 years, you have 167 babies who used to die before they reach the age of 5 by 1980. Now it is decreased to only 24. Mortality rate, adult mortality rate, which is natural death and all those things, that is also decreased from 201 to 149. And birth for women, one of the one of the great improvement is that having 5.6 babies per woman, which was an average in 1980, now it has gone down to 3.3. So you have seen most of the indicator has shown positive growth, but still they are a little bit behind compared to some of the international standards. What are the key problems? The major problem is diabetes, which is between the age of 20 and 79, you have 16.7% people have diabetes, and if you can see, this is the world average, and you can see that Egypt is number 5, and unfortunately this is not a good indicator, but KSA is number 1, followed by Qatar, Kuwait, and the other one is not really Bahrain, and UAE, and then Egypt is there. Not a good indicator, but this is one of the major problem which Egypt is facing. Same is obesity, which is 33%, which is, if you can see, Egypt, it is just below Qatar and Kuwait. Kuwait has the highest in the world, 42, then 33 is Egypt, and 33 is Qatar, and 33 is Egypt. So that is another one of the major problem which we are facing. Hypertension, that's another major problem which we are facing now, and almost 25% of the population above 18 years, they have hypertension. Highest is Croatia in the world, followed by Hungary, Latvian countries, all the Eastern European countries, and then Egypt, and then most of the developed countries are very low hypertension. These are the major problems which Egypt is facing, and as a result of that, all these problems are translating into the top causes of death, which is heart diseases, stroke, cancer, respiratory system, and other things. So that is basically, most of these diseases are reflected into what is needed medically in Egypt. And if you can see that 82% of the total deaths are Egypt's are not natural death. Only 18% are natural death. 82 are because of one of these diseases, which mainly result from these problems. This is very important, and that will going to have an impact on what we see what is required in Egypt. So if you look at the population pyramid, you have 43 million population in 1980, jumped to around 91 million in 2005, and it's expected to be 150 million by 2050. So not only there is an increase in population, but the important thing is how the age profile is changing. So you can see that out of 43, 22 million was under 20-year-old of population by 1980. Now you have around 38 million, and it will jump to almost 51 million by 2050. Just to translate into demand for healthcare, you will have around 85 million new babies will be born between now and 2050. Next 35 years, you are looking around 85 million new babies will be born. Second, between 20 and 60, the age where most of the people work, which is a positive sign and a negative sign. 18 million in 1980, 46 million now, growing to 72 million. This is from healthcare point of view, this is the age group where people work, they get married, they have children, and they basically establish their life and families. But this is the age group where you develop most of the diseases between 20 and especially after 40-year-old, you start developing the diseases which will require treatment in the future. Important thing, very important thing is people above 60 years of age. As I shown in the previous slide, that the population, the age has increased from 58 years to 71 years, resulting in you have only 3 million people over 60 years in 1980. Now you have roughly 7 million. They will jump to around 23 million. That will have a lot of impact on long-term care, rehab, and nursing homes. That will be required. A lot of it, 60,000 beds will be required just for the long-term care and for elderly people. So that the changing profile, if you can see, you have two major impact. One, from healthcare point of view, there will be a lot of demand for mother and child care related facilities, and then you will have a lot of demand for people who will be over 60-year-old, and they will going to live after 60, 10, 15, 20 years or so. How the healthcare is look like now? That's the total beds. You have 43% of 56,000 beds are in government sector, 32% is in semi-government organization, which include military and other, and only 25% beds are in private sector. Whereas if you see number of the hospitals, you have 68% hospitals are in private sector, 13% hospitals are in public sector, and another 19 in public sector and 13% in semi-government sector. If you can see, you have on average, government sector hospital has 100 beds, semi-government has 200 beds, and private sector hospitals has only 24 beds. These are not hospital, 24-bed hospital. We have a lot of design consultants are sitting here and who works in healthcare business. They are not efficient, they not make good money, and these are not hospitals which should, we have to improve the level of these hospitals. Looking at what would be the what would be the bed requirement in future and investment requirement. Egypt presently has 1.5 beds. Looking at 1.5 beds, by 2020 you need around 20,000 more beds in Egypt. By 2030, 45,000 more beds in Egypt, and by 2050, 96,000 beds in Egypt, which require roughly 4 to 6 billion US dollar investment in by 2020, 9 to 15 billion in 2030, and around 30 to 50 billion or so in 1950. But Egypt has 1.5 bed per thousand population, where the world average is 2 beds. If Egypt need to improve, then almost this demand is tripled, and your requirement is also tripled. So lot of investment is required in healthcare. What would be the requirement of doctors, which will reflect into clinic? By 2020, you will have around 50,000 doctors will be required. 2030, 100,000, and by 2050, 216. But this is based on the current ratio of 3.3, which is very high. Normally, efficient ratio is 2.5 to 2.7. So if you keep producing doctor with this ratio, We think and we expect that you will be having an oversupply of doctor after 2020. There will be more doctor which will be required by Egypt economy. But at the same time, you should not be worried about that. We'll discuss that thing. We did a similar project in Jordan last year. And what we think is that instead of looking to produce doctors only for Egypt, you should be looking doctors as an export commodity, because Egyptian doctors, they go and work across the MENA region, and they even go to Europe and USA and others. So this should be considered. For Egypt standard, this will be too many doctors. But if you are considering to look doctors as an export commodity, then in that case, these ratios will be quite healthy. But on the other hand, I don't have the number here, the problem which mostly you're going to face in by 2025 and after that Egypt will have very less nurses which will be available. Especially even now, you lack qualified nurses, and without naming some of the hospital with whom we work, they have qualified nurses from Philippines and other countries. So where the focus should be more on nursing colleges than producing more doctors, unless there is a strategy to treat doctors as an export commodity and basically send them abroad for jobs. Based on that, the clinic requirement, you will need roughly 1.3 to 1.7 million meter clinics by 2020, 2.8 to 3 million by 2030, and by 5 to 7 million square meter by 50. That is one of the most profitable from real estate point of view, from investment point of view, that we have seen is one of the most profitable sector, where investor and developers are investing and they are getting good returns. What are the opportunities? Instead of having large hospital, what we have seen, if you see all over the world, the average daily length of stay has gone down from 7-8 days to 2-3 days. Egypt also has, I think, less than 3 days, 2 point some days now. So with advance in technology and other thing, you don't need big hospital. There is more and more demand for center of excellence or daycare surgery center. That's what we are seeing building across the MENA, across the world, but across the MENA region and Egypt, and I'll come to that. We are working on a number of similar projects. So especially from private sector, should not be concentration on building on 300 bed or 500 bed hospitals. There should be more focus on daycare surgery center and center of excellence. Long-term rehab, that is one of the major things. As I said, that by 2050 you will have 23 million population in Egypt, which will be over 60 years and above, and around 60,000 long-term beds will be required. So that is another thing which we have seen. People are focusing on it. There is very lot of demand for it. But long-term care bed doesn't really mean the long-term bed where patients are on ventilator and something. These are where you go for a rehab. And on the other hand, which we are working also here, and I'll give you some example also, retirement home and nursing home, but not just providing the golf course and other facilities, but also providing healthcare facilities to keep the elderly people in shape. So that would be another thing which will be required. Primary health, which is the clinics and polyclinics, which we said that, you know, between 6 to 10 million square meter of requirement will be there over a period of next 30 years or so, especially in Cairo or most of the GCC country, but especially in Egypt. Doctors would like to buy their own clinics, and that is where there is a opportunity to make projects and make money. A standalone labs and diagnostic center to have more efficient. Now, some of the new MRIs and other, they are so expensive, could range between we are working a project in Dubai, and where one of the MRI, which also has a laser therapy, is cost around $56 million. That cannot be sustained by each and every hospital. So what we are seeing, a new trend is that labs, very highly specialized lab with the best technology, they are not part of hospitals anymore, because the cost of setting up those labs are so expensive that one hospital cannot basically get the return on those. So it has to be standalone, where all the other hospitals are feeding the patients. That is the new thing which we have seen. And you have seen the Baruch lab and other, which you know, very popular here and being acquired by in private equity group from Dubai, Abraj Capital. I think one thing which I do want to emphasize is that Egypt should focus on medical tourism. We did work, as Dr. Kadir was saying, in Sudan. We have work in West Africa, East Africa, in GCC and other. The quality of healthcare in Egypt is still quite good and better compared to most of the neighboring countries. We work in Sudan and other African countries. Those who have money less than 0.5%, they go to US and other places. Those who are maybe 5% or so, who can afford little bit more than that, they used to go to Jordan, but Jordan has put lot of visa restriction now, so a lot of people cannot go to Jordan. So a lot of the neighboring countries, they see Egypt as a quality healthcare at affordable prices. We are not focusing on that. I think that is one of the things where people should focus on it, and should have satellite clinics across the Africa, East Africa, West Africa, North Africa, which will be the feeder to your hospital in Cairo. And yes, I mean, I'll be presenting that also. You have a big population. It's a small in percentage, but very good in size. And because of the lifestyle diseases, where people are focusing on beauty and cosmetic thing. So I think that is one thing which you should be focusing on. That's what we think is the market opportunities. Where to build and what to build. In Cairo, initially everything was in downtown. Then you move east and west. Now, as you know, there is a demand for still in 6th of October in Sheikh Zayed area. But what we think, and the project we are working, is mostly New Cairo and capital city. And capital city, people ignore it. Maybe a lot of people have not gone and seen it. There will be all the ministries and other, the building will be ready end of next year. Most of the people will be, they like it or not, they will be forced to move there because they cannot drive up and down there. So capital city is one of the, New Cairo and capital city, what we think is the area where there will be more demand compared to demand in Sheikh Zayed area. But what we said was, so these are the, what we should build. If you look at the total population, we have, this is the latest data which we got Low income, which is 90,000 Egyptian pound per annum or so, you have around, we're talking about Cairo, you have around 10 million population, 10 million population which are earning less than 89,000 Egyptian pound per annum. Mid income, which is 89 to 445,000 Egyptian pound, you have roughly 6.6 million population. Upper mid income, upper 445 to 1.7 million Egyptian pound, you still have 400,000 population. 400,000 population. And high income, you have around almost 100,000 population in Cairo who earn more than 2 million Egyptian pound. So when we are targeting as a private investor, the low income is mostly will be responsibility of public sector. You still have a very big population of 6, 7, 8 million which you can still cater. So the project which we are looking, you should be looking mainly to mid to upper mid income class. And for the high income, upper mid to high income, you can look at the beauty, cosmetic and other things. What you should be building, as I said, that days of big hospital is gone. The model is normally what we see, and which is very profitable from financial point of view also, that you should have a 100-bed general hospital which you can repeat in different areas, which will have 50-60 bed offering all sort of services, but then 40 beds or so will be specializing, maybe in maternity and child care, maybe in internal medicine and other things. So this thing actually you can repeat, because if you build a 300 bed hospital here, you cannot get any patient from here. The distance and time is so much that you need to have hospitals in different part of Cairo, plus 50 to 100 clinics next to the hospital which are sold to the doctors. You get almost 50% during the construction, the payment or the sale, and 2 years after that. So this actually fund your hospital, which will have a 6, 7 year, 8 year maximum payback period. You still get around 20% return in hospital business, but first 2-3 years you have a big losses. So instead of looking for big hospitals and other, it is better to have 100-bed hospital plus 50 to 100 clinics attached to it, which are sold to the doctors, and you can basically keep on building it across Cairo. I mean, you still have 20,000 bed, so you can actually build 200 such hospitals in next 10 years or so. One thing which we also seen is that from the government sector, the only way forward to basically cater to the whole demand is public-private partnership. The benefit of that is that government can provide land, they can provide maybe in certain cases buildings which are not fully utilized and other. So you have access to private funding, risk sharing, because both public and private sector will be sharing the risk, continuous R&D and access to global network. What we have seen is a lot of hospitals, for example, the new medical center listed in London stock market, and now they have hospital in I think 11 different countries across the road. The Mediclinic, which is a South African, having clinics all over the place. So they bring new technology all the time. Cost efficient because they have different hospital across the region, and they can bring specialist doctor on a short-term basis and others, so they are more cost efficient. Improve and better quality because they are working in private sector. They have to keep the quality and improve it every time, and so that is the benefit. and access to expertise and improved technology. We have seen number of options which hopefully we expect that the public sector will be going to in the same direction, which is either build, operate and transfer, own, operate and transfer, taking an old hospital, make it better and then own and operate and transfer. A lot of operation and maintenance contract, lease and develop, operate. So we can go, there's a lot of agreements or concessions are there which public and private sector can work. And we have seen that there is a quite of interest in especially investor from GCC to come and invest in Egypt. We were involved recently on behalf of, now I can take the name, Emirates Hospital Group, who has taken a major share in Darul Fawad Hospital and As-Salam Hospital. We were involved doing valuation and other work. So there are number of other investor and operator, especially from Saudi and UAE, who are interested to come and make a joint venture partnership or open their own hospitals in Egypt. Quickly, some of the projects which we work in last 18 months or so, which just shows that there's a lot of demand. We did a feasibility for 100 plus hospital in Cairo, which is under, they're raising the financing another. We did a healthcare complex in uptown Cairo, which was supposed to be a hospital in the beginning, but now it will be more of a clinic space. Another 200 bed hospital in the new capital city, which will start hopefully building next sometime in this year. Another 200 beds and 200 clinics in Nasser city, which is under planning. 100 bed rehab hospital, which is basically under planning again. Proposed medical and nursing and pharma college in Cairo, although we recommended not to build medical college, but the client I think is looking to build the medical college. So we did a lot of beauty and cosmetic in North Coast, next to a resort. I'll come to that. A full healthcare city in new capital, that's we did 3 months back. It is still under approval and other thing. A lot of clinics next to the resorts in North Coast. Cairo 111, it is in Nasser city, just opposite City Star, and we did to the extent of what sizes of clinics and everything. Design is not made by us, but what kind of clinics and other, and I think they will be starting breaking the ground in 3-4 months, and we will be looking to sell and lease these clinics also. Couple of more projects which we did in all over Cairo, Alexandria, North Coast. That was a very nice concept, which is the client is starting with Kuwait and Saudi now, but they will going to come. This is one of the private equity group out of GCC. They wanted to build women-only wellness and fitness center across the region, including Cairo. But they are starting with Kuwait and Saudi now. They will be looking to build in Cairo also, probably in 2019. Some of the new trend, 5 minutes more. So we see Egypt has a lot of resorts and development. North Coast and Sukna, all the places, and there's a lot of resort second homes and other stuff. This is the project which we did in last year 2017 in Dubai, Dubai Healthcare City. It's a wellness resort, but not hospitality driven. It's a wellness resort, healthcare driven. They have launched this in Cityscape Dubai a couple of months back. These are the villas, which is very expensive, in the range of 50 million dirham to 70 million dirham. But then they had lot of apartment which was in the range from 1 million to dirham to 3 million dirham, and they sold quite a lot of it as a second home, or the rich people who wants to retire in Dubai market. So this is the new concept which we are also discussing with a couple of developers here, that instead of building only hospitality driven resorts, you should have some wellness resort where you also offer beauty, cosmetic and weight loss and other thing related healthcare services, not a major surgery or anything. What it also help you, that it increase the length of stay in your hotels, because they are also linked, there is a hotel also, they are also normally linked to hotels, on average 3 to 5 days to, depending upon what package, health package they have taken, 20 to 25 days. One thing, as I said, 65 million new babies, 85 million new babies will be born. This is one of the projects which is up and running in Abu Dhabi. We did the feasibility, we find them Parkway Hospital from Singapore as an operator, help them to raise debt financing, help them to raise almost 300 million equity financing. It took 6 years, but now this project is up and running and they are building the second phase of it. One of the best maternity and child care hospital in the region. Other thing which I was talking about, Egypt medical tourism, which we are not facing. This is a project last year we did with Jordan, and it is basically creating one hospital, and like Harley Street in London and Dubai Healthcare City in Dubai, one hospital and lot of feeder clinics which will have creating a sort of a Harley Street of Amman, and they are going ahead with it. The client is going ahead with it, and we are really proud to have work on this project. So this is attracting and increasing the medical tourism in Jordan, and something like this need to be done in Egypt also. That's another project again we did in Jordan, where they are building a new healthcare city, complete new healthcare city, having medical college, nursing college, rehab hospital, general hospital, cancer hospital. So we did a lot of work. Initially the studies were done by Mackenzie, Booz Allen and Bearing Point and PwC, and everybody was there, and we basically, the project was going was not going anywhere. We worked with them in 2016 and 17, and now they will be launching this project because we completely changed this master plan, and now they will be launching this project this year to attract in PPP, to attract mainly regional investors. This is complete project in Jeddah. This was King Abdulaziz University in Jeddah, and they wanted to basically increase their revenues, because King Abdulaziz University cater to a lot of poor people and they don't charge them, and they have lot of losses, and the government was not, there is a change in policy. The government is not looking across the region to fund those losses on continuous basis. What we did was, this is the area where we basically created a new healthcare city which has medicals, clinics, a mall and some other student accommodation and other, which is built by one of the endowment in Saudi. But the main aim of building this project is that because it's an endowment, the losses which is generated by, so that the hospital can keep providing poor people free medical services, they will generate rental income and profit from here, which will be sufficient enough to keep them providing free services to poor people, at the same time not asking for any money from the government, because they will have now an income generating asset. And now we are doing this project in 5 different countries, this similar kind of project. Lot of emphasis, as I said, is from moving away just from the spa, a proper wellness resort and health resort, without offering any operations or critical services, or no even inpatient rooms. That's what we are looking a lot across the region, especially in the UAE. Just a little bit about Colliers. We've been in the region for almost 20 years. We have offices in Riyadh, Jeddah, Cairo, Dubai, Abu Dhabi and Doha. Working in Cairo for almost 12 years, in Egypt for almost 12 years. 91 awards in last 6 years, and these are the awards, especially the Euromoney award, which are voted by 20,000 people or so. So it is not something you can go and become a sponsor and you get the award. We do have market awareness, working 12 years in Egypt. Qualified and experienced staff. Not only we provide real estate related but healthcare related services. We have MBBS doctors working for us who provide lot of input when we are doing feasibility and other thing for hospitals and other. Access to subject matter expert from different. We have a alliance with different companies. Shared knowledge. We always believe in sharing the knowledge. If we work, we don't just give you a report. We'll tell you how to make it, implementable. Creative solution. Don't want to go into detail, but we converted lot of shopping malls into medical center who are not the malls which are not working, they become old and other. Working with one of the Saudi group who is converting old hotels into hospitals, because those hotels cannot generate good cash, but they can be converted into hospital. We produce lot of reports which is available on our website and you can download free of cost. We just issue a report 2 months back on Egypt healthcare market, very detailed report, 24 pages. I presented a very short presentation about the data and other. This report both in Arabic and in English you can download from our website. The team, which is Middle East team, work in all these countries in last 10 years or so, and especially now we have work in Ecuador, Brazil, and also we will be working in Colombia soon. So we will be working across the region, so we get sort of a knowledge and experience what's happening in Africa and other, and that's why I was saying that I think one thing with Egypt is missing is promoting medical tourism. Important thing is that we work with lot of operators. We work with developers, but we work with lot of operators. So when we provide a solution, we know if you are an investor or a developer, you don't know how to operate a hospital. But working with this healthcare operator give us an insight that what operator will need. And these operators are all over the place, from US, from UK, from Thailand, from Singapore, from Middle East, all over the place. We work with almost all the operators in the region, and we are really proud of that. That's about it. If you have any questions, I'm happy to answer any questions.
Is there
presentation? I'm really interested about discussing these communities. Did you work here in the region?
Excuse me?
Did you work on this concept here in the region for the urban communities?
Yes, we are. As I said, we have successfully worked in UAE and Saudi, but we are at a market study and at feasibility study working with a couple of developer in Egypt also.
And how did it go? Because we have...
No, we are just starting those. This is a new concept for Egypt. We just started 3-4 months back with.
Because here in Egypt we have this symptomatic point of view regarding this issue. I can't leave my parents to live alone.
No, I completely understand that. That's why I said that it takes time. I mean, 12-15 years back there was no such thing in UAE. Now we have 5 centers where majority of the patients are Emiratis. And then in certain, one of the other one which we are working in Ras Al Khaimah, the thing was that some of the rich, very bluntly, some of the rich patients said, and we did a survey, that they don't want to live with their kids anymore because they are not at home. They go in the morning, come back at night, or they are traveling and all those sort of things. These were the rich ones, like the one which I show you in Dubai Healthcare City, that I rather buy something where I live with my friends, and so that is, I completely agree. I'm from Pakistan. It's not a common thing that you say I will leave my parents into, but India, one of the biggest market now. So what you say is that we have to move from where elderly people, you just leave them and they are on charity and they are being not taken care properly and other, to provide them a respectable life. And not, I'm not talking about the charity and other, which is, I visited some of them in Cairo. Some of them are quite good actually, without whatever their means are, how they generate the money. But this is more of a people who can afford also to go and live in these kind of communities. So we don't think like, as I said, that now also there is what we mentioned was around 60,000 beds which will be rehab and long-term care. God forbid your father has slept in the bathroom and other, and he needs 3 months treatment. One is that you put him in a hospital which is maybe of not a good quality or very high in cost, and whereas you put him a separate elderly home which also provide rehab, and he is back. So it is elderly home and rehab. When we say it is where people can live long time, but it is also where somebody can go and live for 3 to 6 months. When he is recovered fully, he can come back and live in at his home also again. So it is sort of that kind of thing we are. So we think there will be demand. There will be not like 5,000 beds or so. Probably I see in next 5 years, 4 or 5 of these kind of things will be built in Egypt, not more than that. Yeah, no problem.
Okay, I really do appreciate the figure that you gave at the beginning of your presentation.
Yes.
Okay, so what about the social classes or status of the population? As you know that the Millennium Objectives of UN, the beginning of 2000s, related the demand about the healthcare, education, and so on, and the social status of the populations. So, as you know, we have at least 50% of the populations half full. So in this case, how you take these points and the figure that you showed us? Thank you.
I think, as I showed in one of the slides also, and this presentation, Dr. Kadir can send it to you later, that 50%, as you said, almost 50% or 55% is which earn less than 89,000 Egyptian pound per year, which is like less than what you say 3,000, 5,000 pounds per month or something, and so these are the families. That's why, if you see the recommendation or our conclusion was that you need to look at from 2 points. One is the PPP for those people between public sector who will provide some free land, free properties and other. That is for mainly catering to lower income bracket. There the public sector need to be partner, because the private sector, if they build something, the cost is so high. A 100-bed hospital with land cost you 400 million Egyptian pound to 500 million Egyptian pound, and they need to recover that money. So what you have said, that most of that will be catered to by the public and private partnership, or you move to a system which we have in Abu Dhabi, where everyone has 100% health insurance. The poor people or the low income, which is not just the Emiratis, everybody thinks all the Emiratis are rich, but that's not the case. So the low income Emiratis and low income expats, they pay $300 per year insurance premium, and they can walk into with a referral from a doctor to any hospital, top hospital in Abu Dhabi. So unless you have a full mandatory insurance system, where you will still categorize it different depending upon the premium where the people are going, you will not be able to cater the whole segment, whole income group. So to cater the whole income group, you must have the public sector still participating and developing the insurance. And only last 18-20 years, only Abu Dhabi has able to do it. Maybe one reason is their total population, including the expat, is 4 million. Not like,
Yeah, but I was talking about demands and related to the classes of the populations. For example, you are talking about the rich people in Egypt, the example that you showed in Cairo, maybe we don't need any more clinics or hospitals. But at the same time, for the popular classes, we need more. So this is the issue. I'm talking about the figure that...
I got, sorry, I maybe. So if you see the numbers, it was there. If you see, when we're talking about that 20,000 or 25,000 beds are required, 60% is required for the people who are in low income categories. Another 30% are required the mid income, and only 20% are required in so overall the graph which I've shown you, the beds are also divided more or less in the same ratio. And that's why I said that when 20,000 beds are required, for example, by 2025, all of will not be built by the private sector, because private sector will only going to build where targeting mid to high income, because they need to recover their money. The rest has to be a public-private partnership, where land is very expensive. In certain part of Cairo, you get 50,000 Egyptian pound per square meter. So land is being given. Saudi, they are giving the land. If somebody is building for low to mid income or even lower income, they give the land on a very cheap rate as a lease. So the developer don't have to basically buy the land. In Saudi, they also give, if you are building a hospital, they also give 200 million Saudi Riyal as a loan, interest free, payable in 12 years, to encourage private sector to build hospital which will cater to lower income segment. So for catering lower income segment, there is a need for intervention from the public sector. Without that, it will be very difficult that private sector will cater that. Okay. Thank you very much. I am available for any answers.